So welcome everybody. Today we're going to do an immediate, not rather an immediate, but a stent guided implant for Mr. Mersick. He's been kind enough to allow us to videotape him today. We're going to start by getting him frozen up, and while we're waiting for freezing, we will have Miriam scan the upper jaw in preparation. And we find that the assistants do a great job of scanning, sometimes better than the doctors. The jig has been produced via an iTero scan of the teeth prior to today's appointment, and manufactured and designed to fit in perfectly onto his teeth, and then they position the implant in the exact correct location. So if you notice, the jig has several areas where you have cutouts. These cutouts are to allow the checking of the fit onto the teeth, because you want to make sure that everything is fitting correctly, and if not, then you've got to just relieve some areas. So we'll try this in. So I know it's fully seated down and it's quite snug, so I can push around on it. It's not going to go anywhere. So I'm very happy with this jig now. Beautiful fit and very well designed. So this is the first sleeve that goes in. Now prior to doing that, we're going to actually drill with our first drill. And our first drill is basically to start your pilot hole and allows you to go through the tissue. So we don't have to do a tissue incision. This is just going to make a punch through the tissue and start the drilling process. Once the punch is done, this will come out, and we'll start to use our first sleeve. What the sleeve does is it takes the wide platform hole and the guide that's in the sleeve and narrows down the hole to allow you to fit in a 2mm drill. And this is just a little holder which allows us to position and lock in positioning of the actual guide sleeve. Makes it a little bit easier for us to work and helps hold things in their proper perspective. The system is actually designed to be pretty foolproof, and you'll see as we go through the surgery right up to the prosthetics, this is something that can be done very easily by any general practitioner. It's basically all been laid out already. We've got the CAT scan, so we know exactly where the anatomical features are. We know where the bone is. We've decided the size and length of the implant. It goes to the laboratory. The CAT scan goes with a jig that allows us to position everything. The laboratory then, with the help of the doctor, can decide where the implant is going to be placed. In choosing the implant for Anton, we've actually pushed the implant a little bit on an angle. We could have gone perfectly straight in, but we know that in the future we're going to be making a custom button for this tooth, and we decided to go for where the bone is the best. And where the bone is the best, put the implant in on just a slight angle, which we can then compensate for a little bit later on. And you'll see that as we continue on. How's the freezing now? Any heavier? Any heavier now?
Oh,
freezing?
Okay.
Is it numb?
Yeah.
Yes, for sure? Okay, if you feel anything, you let me know.
Okay.
Okay. So we're going to place our jig into position. And what I'm going to be doing a few times through this procedure is I'll remove the jig so that you can see where we're at and what the effect of each drill is. We're going to be turn a little bit to the side. We're going to start by using our tissue punch, lining it up. It'll find its own angle. And Miriam, as you can see, is going to irrigate while we do that. Anton's got some very dense bone here to go through. So we're going to backtrack a step. If the bone is not very dense, you can go right to that step. But when it's really dense bone, you've got to give it a little bit of something to get through.
Miriam, let me know if you need to.
So we'll place our jig in position. Now we've got a little initial startup. And we'll go back to our tissue punch. Alright, so I'm going to take off the jig so that you can see what the effect of the first drill is. And you can see basically we've done our initial... Can you bring me a photo? Just use yourself. There you go. Can you get that better? Yeah? Okay. So that's our first foray into our preparation. Put the jig back, and the next drill that's going to go in will be our guide drill. So the guide gets placed in position, and we've got markings on our drill so we know how deep to go, but we're actually going to take a verification x-ray in a minute. Hold that there. And then we switch over to the next side drill, which is the narrow plastic drill. These are replace select tapered implants that we're placing in here. With the drill here, you can see you've got an area on the end and then a little lip, and the lip is what controls the depth of the drill, and the bushing is which goes into the bushing of the narrow platform and guides us into position. And stops us. We don't want to go too deep. So this is a narrow platform drill. We have a different sleeve that goes in here to accommodate the size. And turn a little bit, Anton. That's great.